Welcome to today's video about early signs of brain aneurysm. Picture yourself waking up with what feels like just another headache. You assume it's stress or that familiar migraine pattern. But what if this time it's something far more dangerous? Today we're revealing 13 early warning signs of a brain aneurysm that people frequently mistake for migraines. According to the Brain Aneurysm Foundation, approximately 6.5 million people in the United States have an unruptured brain aneurysm, affecting roughly 1 in 50 people. Each year, about 30,000 Americans suffer ruptures, with one occurring every 18 minutes. By the end of this video, you'll know exactly what warning signs demand immediate medical attention. All right, let's jump into the early signs of a brain aneurysm, starting with the first one, the thunderclap headache. The first warning sign is what doctors call a thunderclap headache. Unlike typical migraines that gradually build intensity over minutes or hours, a thunderclap headache strikes with devastating suddenness. The Mayo Clinic describes this as reaching maximum intensity within 60 seconds, often characterized as the worst headache of your life. Survivors describe it as being struck by lightning or experiencing an explosion inside their head. This sudden, severe headache can indicate a ruptured or leaking aneurysm, known as a sentinel bleed. Research in the journal Stroke indicates that 15 to 60% of patients with subarachnoid hemorrhage report warning headaches weeks before major rupture. What makes this dangerous is that people often dismiss these warnings as severe migraines, taking painkillers and hoping the pain passes. The critical difference lies in intensity. If you experience a headache fundamentally different from anything before, reaching peak severity almost instantly, your brain is sending an emergency alarm, requiring immediate medical evaluation.
Next, sign 2, vision disturbances. The second warning sign involves vision problems extending beyond typical migraine aura. While migraine sufferers experience visual symptoms like zigzag lines or flashing lights, aneurysm-related vision problems present differently. The National Health Service reports that aneurysms, particularly near optic nerves or posterior communicating artery, cause specific symptoms, including double vision, blurred vision, or drooping eyelid. These occur because the aneurysm physically compresses nerves controlling eye movement and pupil function. Unlike migraine aura lasting 15 to 30 minutes, aneurysm-related problems persist and may worsen over time. You might notice one pupil becoming larger than the other, called anisocoria, when an aneurysm compresses the third cranial nerve. The key distinction is persistence and progression. Migraine visual symptoms are temporary and follow familiar patterns. Aneurysm-related changes are new, persistent, and often accompanied by other neurological symptoms. If you develop new persistent vision problems, especially alongside severe headache, this warrants immediate medical attention with brain imaging. Next, sign 3, neck stiffness and pain. The third sign is neck stiffness feeling distinctly different from neck tension with migraines. Many migraine sufferers experience neck discomfort, often describing muscle tightness or soreness. However, neck stiffness related to brain aneurysms has a unique quality. Cleveland Clinic explains that when blood from a ruptured aneurysm enters the subarachnoid space, it causes meningeal irritation, leading to severe neck stiffness called nuchal rigidity. This isn't stiffness that improves with stretching or massage. It's rigid stiffness, making it genuinely difficult to bend your neck forward, bringing chin toward chest. Healthcare providers test for this sign because it's a classic indicator of subarachnoid hemorrhage. The stiffness develops because blood in cerebrospinal fluid irritates protective membranes around brain and spinal cord, causing them to become inflamed and rigid. This neck stiffness can take several hours to develop after initial bleeding. If you experience severe, rigid neck stiffness accompanied by intense headache, especially if the headache came on suddenly with thunderclap quality, this combination demands immediate emergency evaluation.
Next, sign 4, nausea and vomiting. The fourth sign involves nausea and vomiting, symptoms that overlap with migraines, making differentiation challenging. Research confirms that nausea affects up to 90% of migraine sufferers, and vomiting occurs in about 1/3 of migraine attacks. However, differences emerge when these symptoms stem from brain aneurysms. When an aneurysm ruptures or leaks, a sudden increase in intracranial pressure triggers the brainstem's vomiting center, often causing projectile vomiting occurring suddenly without typical nauseous buildup you might experience with migraines. Medical literature indicates that nausea and vomiting occur in approximately 40 to 50% of patients with ruptured aneurysms, often accompanied by other serious neurological symptoms. Context matters tremendously here. If you experience violent vomiting alongside the worst headache of your life, vision changes, or altered consciousness, this combination points toward a neurological emergency rather than migraine. Timing provides crucial clues. Migraine-associated nausea typically develops as headache intensifies and may improve as the headache phase passes. Aneurysm-related vomiting often occurs at onset of thunderclap headache and can be severe and persistent regardless of whether headache intensity improves. Next, sign 5, sudden confusion or altered consciousness. The fifth warning sign is sudden confusion or altered consciousness, rarely accompanying migraines, but frequently signaling serious neurological events like aneurysm rupture. While some people with severe migraines experience migraine fog involving difficulty concentrating or finding words, this differs distinctly from confusion caused by brain aneurysms. Medical research describes how increased intracranial pressure from bleeding affects brain function, leading to disorientation, difficulty understanding surroundings, trouble recognizing familiar people, or responding inappropriately to questions. Approximately 25 to 30% of patients with subarachnoid hemorrhage experience altered mental status, ranging from mild confusion to complete loss of consciousness. This happens because blood in subarachnoid space increases brain pressure, disrupts normal cerebral spinal fluid dynamics, and can cause vasospasm, which narrows blood vessels and reduces blood flow to brain tissue. The confusion can manifest as saying things that don't make sense, having trouble understanding simple questions, or exhibiting unusual behavior. Family members often notice these changes before the affected person does. If someone develops severe headache accompanied by confusion, disorientation, or any consciousness change, this constitutes a medical emergency requiring immediate hospital evaluation. The distinction from migraine is clear. Migraines may affect concentration, but rarely cause true disorientation or inappropriate environmental responses.
Next, sign 6, seizures. The sixth sign involves seizures, a dramatic symptom that should immediately distinguish an aneurysm event from migraine. While migralepsy exists, where seizures occur during migraines, this is exceptionally rare. In contrast, seizures occur in approximately 6 to 20% of patients with aneurysmal subarachnoid hemorrhage. These seizures happen because blood in brain tissue or increased intracranial pressure irritates the cortex, causing abnormal electrical activity. Seizures can range from generalized tonic-clonic seizures involving convulsions and loss of consciousness to focal seizures affecting specific body parts or causing unusual sensations. Medical research indicates that seizures occurring at aneurysm rupture are associated with significantly poorer outcomes, making immediate medical intervention absolutely critical. The mechanism differs entirely from migraine-related neurological symptoms. Migraine aura involves spreading cortical depression, a wave of decreased brain activity producing visual or sensory symptoms, but not true seizure activity. An aneurysm-related seizure represents acute brain injury from bleeding, swelling, or direct pressure on brain tissue. If you or someone experiences a seizure accompanied by severe headache, this demands immediate emergency medical services activation. Don't wait, don't drive to the hospital, and don't dismiss it as stress-related without proper medical evaluation. Next, sign 7, speech difficulties. The seventh warning sign manifests as speech difficulties going beyond word-finding problems sometimes associated with migraine aura. Some migraine sufferers experience transient aphasia during aura phase, typically lasting less than 1 hour and resolving completely. However, speech problems related to brain aneurysms present differently and more persistently. Medical literature indicates that aneurysms affecting certain brain regions, particularly the left middle cerebral artery supplying language centers, can cause sudden aphasia or dysarthria. Aphasia involves difficulty finding words, understanding language, or expressing thoughts, while dysarthria involves slurred or garbled speech despite knowing what you want to say. These symptoms occur when aneurysms rupture or enlarge, either directly damaging language areas or reducing blood flow to these critical regions through vasospasm. Approximately 10 to 15% of patients with middle cerebral artery aneurysms present with language disturbances. The key differentiator is onset and duration. Migraine-related speech difficulties typically emerge gradually as part of aura, last less than 60 minutes, and resolve completely before or as headache begins. Aneurysm-related speech problems tend to be more sudden, persistent, and often accompanied by other focal neurological symptoms like weakness on one body side. If you suddenly struggle speaking clearly, can't find common words, or have difficulty understanding others, especially alongside severe headache, immediate medical evaluation is essential.
Next, sign 8, loss of balance or coordination problems. The 8th sign involves loss of balance or coordination problems, feeling fundamentally different from migraine-associated dizziness. Many migraine sufferers, particularly those with vestibular migraines, experience vertigo, dizziness, or balance problems as part of their symptom complex. However, these symptoms typically follow familiar patterns and resolve with the migraine. Balance problems related to brain aneurysms, especially those in posterior circulation affecting cerebellum or brainstem, present more severely and persistently. Medical research indicates that posterior circulation aneurysms, though less common than anterior circulation aneurysms, frequently present with ataxia, the medical term for loss of coordination and balance. When aneurysms in this region rupture or compress surrounding structures, they disrupt the brain's ability to coordinate movement. Patients describe sudden difficulty walking, feeling like they're going to fall, or inability to coordinate hand movements. This differs from migraine-related dizziness in several ways. Migraine dizziness often involves spinning sensation or lightheadedness improving with rest, whereas aneurysm-related ataxia manifests as actual inability to coordinate movements, difficulty walking straight lines, or repeatedly dropping objects. If you experience sudden loss of coordination, especially accompanied by severe headache or other neurological symptoms, this warrants immediate medical evaluation. The cerebellum controls fine motor coordination, and any damage to this region or its blood supply can have serious implications if not addressed promptly. Next, sign 9, facial pain or numbness. The 9th warning sign presents as facial pain or numbness, differing in character and location from typical migraine pain. While migraines commonly cause unilateral head pain that may radiate to face, aneurysm-related facial symptoms have distinct characteristics. Medical research indicates that aneurysms in specific locations, particularly those involving cavernous sinus region where carotid artery passes through skull base, can compress cranial nerves responsible for facial sensation. This compression produces numbness, tingling, or altered sensation in specific nerve distributions rather than more generalized pain patterns of migraines. Studies describe how cavernous carotid aneurysms can present with facial pain mimicking trigeminal neuralgia, but not responding to typical trigeminal neuralgia treatments. The numbness or pain follows specific patterns based on which trigeminal nerve branches are affected, potentially involving forehead, cheek, or jaw. Approximately 5 to 10% of cavernous sinus aneurysms present primarily with facial pain or numbness. What makes this particularly challenging is that these symptoms can exist without typical thunderclap headache, especially with unruptured aneurysms that grow slowly over time. If you develop new-onset facial numbness or pain not fitting your usual migraine pattern, particularly if it's persistent and localized to specific facial areas, neurological evaluation, including brain imaging, is warranted to rule out structural causes.
Next, sign 10, photophobia and phonophobia. The 10th sign involves photophobia and phonophobia, meaning sensitivity to light and sound respectively. This presents diagnostic challenge because both symptoms are migraine hallmarks, affecting up to 80% of migraine sufferers according to research. However, intensity and context of these sensitivities can provide clues when differentiating migraines from aneurysm-related events. when brain aneurysms rupture, causing subarachnoid hemorrhage. Resulting meningeal irritation from blood and cerebral spinal fluid produces severe photophobia and phonophobia beyond typical migraine sensitivity. Medical research describes how this meningeal irritation causes extreme sensitivity where even dim lighting feels intolerable and normal conversation volumes seem unbearable loud. The critical difference lies in company these symptoms keep. Migraine-related light and sound sensitivity, while uncomfortable, exists as part of recognized pattern, often improves in dark, quiet rooms, and gradually resolves over hours as migraine passes. Aneurysm-related photophobia and phonophobia accompany other serious symptoms like thunderclap headache, neck stiffness, altered consciousness, or neurological deficits. According to clinical observations, sensitivity associated with subarachnoid hemorrhage often persists even with pain medication and doesn't follow typical migraine timeline of improvement. If you experience extreme light and sound sensitivity alongside other warning signs discussed, particularly sudden severe headache or neck stiffness, this combination suggests something more serious than migraine, requiring emergency evaluation. Next, sign 11, weakness or numbness on one side. The 11th warning sign manifests as weakness or numbness affecting one body side, a symptom that should immediately raise concerns about stroke or aneurysm rather than migraine. While hemiplegic migraines exist, a rare subtype causing temporary one-sided weakness, this diagnosis should only be made after ruling out more serious causes. Medical research emphasizes that new-onset unilateral weakness demands immediate stroke protocol evaluation. When brain aneurysms rupture or cause complications like vasospasm, they can reduce blood flow to specific brain regions controlling movement and sensation on the opposite body side. Approximately 15 to 20% of patients with aneurysmal subarachnoid hemorrhage develop delayed ischemic deficits, including weakness or numbness due to vasospasm occurring days after initial rupture. The weakness can range from subtle difficulty with fine motor tasks to complete paralysis of arm, leg, or face on one side. This differs significantly from hemiplegic migraine in several ways. Hemiplegic migraine typically has family history, develops gradually over minutes, and resolves completely within 72 hours according to International Classification of Headache Disorders criteria. Aneurysm-related weakness tends to be more sudden, may progress rather than improve, and is often accompanied by other serious neurological symptoms. If you develop sudden weakness or numbness on one side, especially with severe headache, this constitutes stroke-level emergency requiring immediate hospital evaluation with brain imaging.
Next, sign 12, dilated pupil. The 12th sign involves a dilated pupil, technically termed mydriasis, representing direct compression of cranial nerve 3 by an expanding or ruptured aneurysm. This is distinctly different from anything associated with typical migraines. Medical research explains that posterior communicating artery aneurysms, due to their anatomical location, frequently compress the oculomotor nerve as it passes nearby. This nerve controls pupil constriction, eyelid elevation, and most eye movements. When compressed by aneurysm, the pupil on affected side dilates and becomes unreactive to light. The eyelid droops, and the eye may turn outward. Approximately 90% of patients with posterior communicating artery aneurysms large enough to cause symptoms present with some degree of oculomotor nerve dysfunction. The pupil changes are particularly concerning because they often indicate aneurysm at high rupture risk or one that's already bleeding. In medical practice, a blown pupil in context of severe headache is treated as aneurysm until proven otherwise. The mechanism is purely mechanical compression, unlike migraine, which involves neurochemical changes but doesn't cause structural nerve compression. If you notice one pupil is significantly larger than the other, especially if accompanied by drooping eyelid, double vision, or severe headache, this demands immediate emergency evaluation. Time is critical because these signs suggest significant aneurysm size or complications that could rapidly worsen. Next, sign 13, pain behind the eye. The 13th sign is pain behind the eye, a symptom occurring in both migraines and brain aneurysms, making careful attention to accompanying symptoms essential. Many migraine sufferers describe deep, aching pain behind or around one eye, and cluster headaches notoriously cause severe pain centered around the eye. However, Aneurysm-related eye pain has specific characteristics worth understanding. Medical research indicates that aneurysms in cavernous sinus or near optic nerve can cause orbital pain that patients describe as deep, boring pain behind eye. Internal carotid artery aneurysms can present with retroorbital pain as their primary symptom, sometimes existing for weeks or months before rupture. This pain occurs because aneurysm irritates or compresses pain-sensitive structures, including dura mater and cranial nerves in the region. The distinguishing factors include persistence, progression, and associated symptoms. Migraine-related eye pain typically follows familiar pattern, responds to migraine treatments, and occurs in discrete episodes with pain-free intervals. Aneurysm-related orbital pain tends to be constant or progressively worsening, doesn't respond well to typical pain medications, and may be accompanied by vision changes, pupil abnormalities, or eye movement problems. If you develop new, persistent pain behind your eye, especially if accompanied by vision changes, unusual headaches, or neurological symptoms, seeking medical evaluation with appropriate imaging is crucial for proper diagnosis and potentially life-saving treatment. We've journeyed through 13 critical warning signs that could indicate brain aneurysm rather than simple migraine. Remember, while migraines are common and brain aneurysms relatively rare, the stakes couldn't be higher. The key is recognizing patterns differing from your normal experience, particularly thunderclap headache reaching maximum intensity within seconds, or any symptom combination we've discussed. If you found this information valuable, please type "valuable" in the comments below. Your feedback inspires us to continue creating evidence-based health content. Don't forget to click the like button, share it with family and friends who need this information, and subscribe to our channel with notifications on. Thank you for learning about your brain health today. Your awareness could make all the difference. Stay informed, stay safe, and remember that when it comes to sudden, severe headaches feeling different from anything before, it's always better to be evaluated than to dismiss something potentially serious. Take care, and we'll see you in the next video.